biologics and the regulatory system. And your advisor is Professor Henry.
Yes. Before I start, I want to say thank you, obviously to my advisor, wherever he may be. He's somewhere over the Atlantic right now on the airplane. He was a lot of emotional support for me during this, and he's also the one person on campus I found to get really excited about this topic before I actually knew what I was talking about. The second person I would like to thank is Mary Sprague and also Marcella. Thank you guys for your support in this thesis. Also, thank you to my dad for pointing out the irony that I'm trying to propose to liberalize the pharmaceutical market while currently going to school because he made a really good investment on a biologic 10 years ago. But aside from that, I'll get started. So the title of my thesis, if you can believe it, this is actually half the length I used to be, but you know, it's still there. The title is How International Trade Policy Can Be Utilized to Rectify Problems Within the United States Biologics Regulatory Exclusivity System. That's the only part of my presentation I don't have memorized. I understand that this title is really verbose, and I'm going to take probably the first half of my presentation to try to tell you what exactly I mean by that. I'm going to start out with some background information. This includes some motivation for why I wanted to start this endeavor in the first place, as well as some more definitional overviews that are necessary in order to understand my argument. I'm going to give you my argument in 3 phases. The first is that U.S. intellectual protection is flawed for specialized pharmaceuticals. The second is that the European Union system is much better in promoting a competitive market. And the final is that international trade policy is the best way to make a policy change in this arena as it relates to the United States. Okay, I only highlighted this in red to emphasize it, but like this is really my thesis. This took me a long time to figure out, and I'm really excited about it. So, are you excited, Professor Austin? All right, good. All right, so some motivation and background information. I was an intern for Ambassador Michael Froman. He's the United States Trade Representative in the Executive Office of the President. I spent a long time trying to learn about trade legislation. I met with every single employee in the office that I could, sat down with the intellectual property negotiators, set up meetings with the Department of Commerce, stole a lot of presidential stationery, and really tried to soak up as much as I could about international trade. It's something I knew very little about. It's something which a lot of U.S. citizens are very disconnected from, and it's something that I believe is very important. In this thesis, I wanted to combine what I know with what I care about, so that's what I know. What I care about as an overarching theme of my time here studying economics and public health is the relative competitiveness of the market for pharmaceuticals. I think this is incredibly important for all U.S. citizens to understand, and it affects us on a daily basis. I heard this really great quotation, which was, you can solve any problem once you know what you're solving for. That really was the theme of my thesis, trying to figure out if there was something that needed change and if I could change it. I think there is, and I think I figured out a way. So some background information. I want to be candid with you. This background information, which I'm covering in about 5 slides, took me about 3 months to understand. So here we go. Biologics and new chemical entities. These are the 2 kinds of pharmaceuticals that the United States produces. It can be very difficult to understand the differences between the 2, so I've come up with a metaphor which I will hope makes it a little more clear instead of less clear. I was a math minor here for about 3 months, so I used a math metaphor. New chemical entities can be thought of as a simple algebra problem. X is always one thing. You add up chemicals to create a drug, they can be easily replicated, and nothing really changes. This will give me post-traumatic stress disorder. This is a multivariable calculus problem. X is only one thing when Y and Z are another. Every variable changes depending on the variables around it. Biologics are organic compounds. 2 organic compounds are rarely, if ever, the same. That has huge implications for the regulation and replication of biologics, which means it has huge implications for policy. So biologics producers face some pros and cons, obviously, in their decision to make this kind of drug. The biologics treat specialized diseases. There's a new and burgeoning market due to advances in the protein production process. That's not particularly important, but anyway. That lead to biologics being able to treat more specialized and nuanced diseases. However, there's this potential profitability. They can either come out as this huge blockbuster drug like Humira, which was originally supposed to treat rheumatoid arthritis but ended up having a lot of treatment capability, or they could come out as a very, very nuanced drug like Orkambi, which treats cystic fibrosis. Now, very few people are willing to pay a lot for Orkambi, but not much can be said of a lot of other biologics. In addition, they're very hard to regulate and replicate, which has large implications for the market for biosimilars, which are the generic form of biologics. All right, moving on to something called regulatory exclusivity. This is the bane of my existence because my misunderstanding of regulatory exclusivity caused me to rewrite my thesis this March. So regulatory exclusivity is far different from a patent, as I found out the hard way. A patent, as all of us know, many of us know, some of us took a while to know, grants market exclusivity for the producer. It grants the producer the right to be the only maker or seller on the market, but it's granted at the filing date, which is far before the date of market approval. This means that the 20 years that someone is given for a patent rarely correspond, in this case, to the time when the drug is actually on the market. Now, regulatory exclusivity, on the other hand, is granted on the date of market approval, so there's a one-to-one correspondence in those years. There are two kinds of regulatory exclusivity: regulatory market exclusivity and regulatory data exclusivity. I do have to say regulatory market and data exclusivity. I really can't abbreviate it, unfortunately, so I'm going to be saying that a lot. Regulatory market exclusivity is similar to a patent, but they are entirely separate entities. They do grant the holder the same rights, but they are granted at separate dates by separate people. Regulatory data exclusivity is giving the owner the right to all of the data leading to their invention. This is a huge deal, and I can't stress this enough. In the case of biologics or drugs, it gives the user the right to protect their clinical test trial results, their methods of production, and in the case of biologics, it even gives the owner the right to protect what is actually patented, which is very interesting. This has huge implications for policy, again, and gives the owner a huge amount of protection from those looking to enter the market. Big takeaways here: biologics are complex and technical. Those wishing to produce them face a very large risk-reward trade-off for profitability, and regulatory exclusivity grants a huge amount of protection to producers of drugs. All right, so I'm moving into the United States analysis. The Affordable Care Act is a piece of legislation I'm concerned with here. Unsurprisingly, most people, including me before this thesis, did not know that the ACA directly addresses biologics regulatory exclusivity. That means it directly addresses intellectual protections for specialized treatments. It established that biologics producers are to receive 12 years of regulatory exclusivity from the date of market approval. A subset of the ACA, called the Biologics Price Competition and Innovation Act, created a legal pathway for the approval of the generic form to biologics, which are biosimilars. I don't know if anyone in this room is a scientist. If you are, don't blame me. The reason I'm calling biologics or biosimilars the generic form is because that's the simplest way to put it. That's not technically correct, but we're moving on. I want to make sure to tell you that this is not the same as previous legislation granted towards generics of new chemical entities, which are typically the kind of pharmaceuticals we think of. And when I say generics, it is exactly what you think. It's like the generic, like acetaminophen, ibuprofen, this kind of thing. So the Hatch-Waxman Act created an abbreviated pathway for the approval of generics, whereas the BPCIA created a pathway in the first place. It did so by creating an abbreviated new drug application, wherein the generics producer didn't have to prove safety, potency, and purity in such a rigorous form. It also provided for the public listing of all new chemical entity patents in something called the Orange Book. So even if the data of a drug is protected, unlike a biologic, generics producers can actually see what has been protected. We can understand the relative competitiveness of a market by understanding how hard it is for a generic to get on the market. So for new chemical entities, United States legislation dictates that they receive 5 years of regulatory exclusivity. Once these are over, granted the patent has also expired, a generics producer will submit an abbreviated new drug application, create an exact replica of the drug, and be on the market in relatively few months. Biologics, on the other hand, are granted 12 years of regulatory exclusivity. I want to make sure you know that this is not my argument. I have no idea if 12 years is the right amount. I don't know if 5 years is the right amount. What I'm concerned about, however, is that once these 12 years are up, the situation, unfortunately for me and my advisor, gets far more complicated. So there's this problem in the United States legislation that leads biosimilars producers to have to rely on something called the patent dance. This is actually what it's called. The patent dance is where a biosimilars producer and a biologics producer enter into this complex battle of litigation to find out what patents are infringed or not infringed. That essentially means that the BPCIA considers this to be a fast track for the production of biosimilars, which I will never understand. The reason that they believe this is a fast track is it's because it's somehow a backdoor into the data of the biologics producer before the 12 years has expired. However, it's really going around the problem in the first place, and I'll get to that in a little bit. The fact that there is no Orange Book, which is the reason for this patent dance, and no abbreviated pathway for the production of biosimilars is really not something I can suggest that to be changed. This is because biologics are far too complex to have an abbreviated pathway or even to have a public listing of patents, because a lot of biologics producers don't even know what they're patenting when they file the patent, which is very complex. However, there is a problem that I'd like to talk about, and it's a huge problem, and it's very difficult to understand, but that is that there is no staggered expiry of regulatory exclusivity. This essentially means that the data of a drug becomes public at the same time that the drug loses market exclusivity. This means biosimilars have absolutely no chance, given the fact that there's no abbreviated pathway, and the fact that their fast track is something about patents, which doesn't matter for them. They have absolutely no chance to get onto the market in time to become a true competitor at the time of market exclusivity expiration. So my suggestion is that the data should become public before the market exclusivity expires, and you'll see where I got this idea in a little bit. So even after studying the patent dance for quite a long time, it's difficult for me to wrap my head around it. My advisor has assured me that it is intentionally complicated and that it is not just me. And the reason it's intentionally complicated is because pharmaceutical producers have a lot of power in Congress. They don't necessarily want biosimilars to be approved on a true fast track. We often don't see how policy really works until it's put into practice. And luckily for me, but unluckily for Sandoz, there was a case between two pharmaceutical producers, Sandoz and Amgen, which directly addressed the patent dance. So here's what happened, in my layman understanding of cases. Sandoz essentially created this biosimilar called Zarxia. It was a biosimilar that would compete directly against one of Amgen's drugs. They sidestepped the patent dance completely, essentially saying, no, we don't want to do that, that really has no benefit for us, and we would rather get to market as quickly as possible. Amgen found a loophole, turned around and sued Sandoz and says, no, you have to go back and get into a legislative war with us over patents, which didn't matter anymore because Amgen's regulatory exclusivity had already expired. This is actually extremely absurd. Amgen lost the case, but I'm sure we're not going to see the end of the debate. But Amgen actually won because they got an extra 6 months of being the only one on the market as a consequence of the fact that there was a court case to begin with. Sandoz got a 180-day stay for the market, and this is bad because the regulatory exclusivity had already expired. This is evidence that the pathway in place is certainly not sufficient. Congress has deemed that 12 years is the correct amount to give to biologics producers. I will not argue with Congress, but I will say that this seems to act in practice as more of a minimum than a maximum, and this is likely due to the political power that pharmaceutical lobbyists have. I would also like to say that the Obama administration has come out publicly and said that they want to reduce intellectual protection to 7 years, but there seems to be some friction in public and private discussions of this. Zarxia, which was Sandoz's biosimilar, is also the only biosimilar to have been approved in the United States in 6 years. So we have nothing to compare it against, and clearly something is not working. I'll compare it to the European Union analysis. I want to say, even though I don't cover it here, there are problems with the EU system, and I'd be happy to get into those because they made up a large portion of my thesis. But the real crux of the thesis regards regulatory exclusivity, which is what I'll talk about. So, the European Union passed the equivalent of this Biologics Price Competition and Innovation Act in 2003, which is 7 years earlier than the United States. Even though they've had substantially longer to mature, theoretically, they treat biologics the same as new chemical entities. My opinion is it's probably because they tend to favor the consumer over the producer, evidenced by the existence of price controls. Furthermore, the EU has approved 22 biosimilars as opposed to the United States 1, and something is working in the EU that's not working in the US. Their system is known as the 8+2+1 system, makes it very easy for me to understand. The 8 years is the original granting of regulatory data and regulatory market exclusivity. Even though it just says data, they are granted in tandem. So the original 8 years of that exclusivity, followed by an extra 2 years of just market protection, and options for 1-year extensions if the European Medicines Agency believes that there's a new indication and they deserve to make more money. The crux of this system is this 8+2 part, and we can see that, interestingly enough, new chemical entities and biologics are the only ones in the market, are allowed to be the only ones in the market for a full 10 years. But the data becomes public before the market protection expires. This means that biosimilars at least get a head start in the production of their generic form before the market expiry of the branded drug. Up until this point, I've made a few controversial points, ones that I know at least my dad would disagree with. The first is that the United States regulatory exclusivity system is flawed, and the second is that it should copy the EU system. I understand that I'm simply adding my opinion to this conversation that already exists. There's a lot of economists and analysts who have discussed this thoroughly and argued over it hotly. However, my real contribution to this conversation is that regardless of what change you believe should be made, it should be made, if you're making a change to the United States, through international trade. So just to recap, if I were to design the best biologics regulatory exclusivity system, I would pretty much have the skeleton of the EU system with staggered expiry of market exclusivity and data exclusivity, and specified extensions for new indications. I would suggest the most justifiable way to implement this as a global standard is to put it in the trade-related aspects of intellectual property rights. This is the WTO legislation regarding how to address patents for new chemical entities and other things in international trade. The reason I think this is justifiable is because currently there is no international legislation regarding regulatory exclusivity or biologics, and the market is simply going in that direction, so I think it's necessary. However, the reason that I suggest using international trade is to get away from political power that pharmaceutical producers have in Congress. This is not going to do that. The WTO, the United States is a hugely influential member of the World Trade Organization, and I'm certain that Congress would have a say. So, what I suggest using instead is the Transatlantic Trade and Investment Partnership. This is a current trade deal being negotiated between the United States and the European Union. Why use it? It's essentially a mirroring. I'm arguing that the United States mirror the EU system. This is more likely to happen in a bilateral negotiation. Also, in terms of biopharmaceutical production, the US and the EU are on more equal levels, so the global power dynamic is not so skewed. Thirdly, it's currently in negotiation, so my thesis, at least for now, is still relevant. So I'm suggesting that we use an ITA to get away from political power of pharmaceuticals producers. Is this actually possible? There are 3 steps to an international trade agreement being put into play. The first is negotiation, then ratification, and then implementation. We can take cues that the United States is willing to be flexible on this from the Trans-Pacific Partnership. If you don't know what the TPP is, or haven't been watching the political debates on the Trans-Pacific Partnership, it is a trade agreement between 12 Pacific Rim countries addressing a whole host of things, including biologics regulatory exclusivity. The United States agreed, it seems, though the TPP is still private, to negotiate down from 12 years to 8 years. This has huge implications for my thesis, and I'd be happy to talk about them in the questions section. However, we see that the United States tends to be flexible, mostly because this gets, the microfilm doesn't necessarily report to Congress in negotiation. The second is it's a public goal of the United States to reduce regulatory exclusivity. My entire thesis would be a moot point if an international trade agreement, after being negotiated, could be substantially amended by Congress. Luckily for me, on my first day, I kid you not, as a federal intern, the Trade Promotion Authority passed. This essentially reduces any discussion of an ITA in Congress down to an up or down vote, and no ITA can be amended by Congress. I want to make sure to note that this is the reason that my thesis is possible. This is the key towards making change happen in the United States through an ITA, and it's completely legal and completely justifiable. So we have no example of a biologics regulatory exclusivity system being implemented in the United States as a cause of an ITA, but that's simply because the market is catching up with, or policy is currently catching up with the market. However, I consider this to be incredibly important, and I think anyone who's interested in the price of drugs should keep a key eye on this in particular. Biologics regulatory exclusivity is incredibly important. It affects us on a day-to-day level in a way that we don't realize. United States citizens, and I'm noticing even public health scholars, including myself at Stanford University, don't understand it very well, and that's because it's very complex and technical. I will tell you that the necessary information to even understand my own argument took me months to find and to read because it is far few between and very, very dense. But it's incredibly important for us to understand as individuals. This almost seems like a trick to make necessary change happen, and I want to make sure that as many people as possible understand it and are excited about it. So with that, thank you very much, and I welcome any of your questions. Yeah?
That's terrific. I have lots of questions.
Yeah, good. Me too.
Let me just give you 2 or 3 of them, and then
Okay, sure.
you respond. Do you think do you think there's any chance that TTIP is going to get through in the foreseeable future?
No.
Second, TPP, the bits we know about it,
Yes.
if we haven't seen it, I mean, it's got no chance of being ratified before the new president comes in.
It might be renegotiated.
Well, no, it will be.
Yeah.
But it has to be, because it's not just the US that objects, it's every member. And that was predictable right at the get-go. It's too ambitious to ever be a clean
The
treaty.
TPP is an interesting case.
But the question there is, given what the candidates have been saying, is the only hope that a lame duck president and Paul Ryan will somehow get a fast-track authority vote before President Trump and or President Clinton has
I don't
to
wanna
come
hear those words.
and backtrack, because it's dead if you believe what they say. Third thing, which is more interesting for me, I mean, one of the big objections on the biologics in the TPP negotiations was Australia, because legally they could not give 12 years protection. Under Australian law, I think 7 years was the maximum, and this is the 8-year compromise. But the US pushed very hard to get company-state legal cases. In fact, Congress has just said that American citizens can take on Saudi Arabia if they feel that 9/11 caused them problems. I don't know how they feel about fallout from drone attacks or something like that, so the tit-for-tat problem that might emerge. But do you think it likely that the pharmaceutical companies, with the power that they exert, are now going to have a sort of blitz on taking on countries within which companies begin to threaten their patents?
I mean, so to answer your first question about the Transatlantic Trade and Investment Partnership, I've talked to my advisor about this a lot. As much as I wish that it was passed, because I am a wholehearted supporter of international trade, I'm not sure. That's mostly because the political climate is changing around trade in a way that, to me, is frightening. So I have no idea if the TTIP will pass, and in fact, I probably believe that it won't. At the time of the publishing by myself of this paper, I did believe that it would pass, but in the recent weeks I'm a little more concerned. The second point, which was on Trans-Pacific Partnership, correct?
Probably.
Probably.
Yes,
Australia.
Fast track authority question.
Yeah, the fast track authority question. I actually talked to Condoleezza Rice about this last week, which is something that I can't believe I just said. But I did talk to her. I talked to her about this last week, and she and I both agree that it's likely it's a political power move right now to say that you're not for the TPP.
Of course.
And that I wonder, because the TPA is going to be in place until 2021, I do wonder if there's going to be more of a push towards free trade once, hopefully not Trump gets into office. I don't know if I just gave away my party, but and then the third question, yes, I think there would be a huge fallout from pharmaceutical producers, and I think my dad's going to be their lawyer. So
Very interesting.
Yeah.
So part of this I don't understand, which is the information piece, right?
Yeah.
That they hide all this stuff in the United States, but in Europe it's an open book.
Yeah. Are you talking about the patents, or are you talking about trade agreements?
No, the patents.
Okay.
The patents and the regulatory data exclusivity,
Yeah.
where you say, wow, in Europe we have 22 biologics passed and only one in the United States, and that's because they have their open book in Europe.
The
Well,
patents,
that seems like that that opens the book ahead of time, even though the United States says it's closed.
Yeah.
Is that? I mean, that kind
You're not
of
wrong.
undercut the argument that we need to open the book in the United States early too.
You're not wrong, but the only thing is the difference between opening patents and opening data exclusivity is pretty nuanced. Patents are only showing what is protected, and the data exclusivity is showing how it was produced.
So which do they open in Europe?
In Europe, as far as I know, only two chemical entities have an Orange Book. In fact, I don't know of any legislation that really mandates that. In the United States, the Orange Book mandates that all new chemical entity patents be public.
Right.
Yeah.
On the new chemical entities open in the United States because of the Orange Book, but in Europe you said they have regulatory data exclusivity open much earlier.
Yes, but regulatory data exclusivity is far different than a patent.
Right. No, but that allows them to replicate the stuff, right?
Yes.
So if it's open in Europe, then the companies can go and do all their work based on the European information.
I mean, Europe has a smaller share of the biopharmaceutical market than the United States.
But I mean, you
does.
still have to. I would think you have to
Yeah.
do the research, and then you can do it ahead of time in the United States, and then be ready to file day 2 because you've already done it based on your information in Europe.
If you want to file for an international regulatory exclusivity, if you'd like to compete against a European drug instead of a United States drug, that's a way to do it as biosimilars.
But they're not the same.
But they're not the same.
Not the same drug.
They're not the same drugs, right? So European pharmaceutical producers produce one kind of biologic, and the United States will produce other kinds of biologics. I mean, other biologics. They're not just international companies.
Okay.
Does that make
If
sense?
somebody, no, I thought that if you developed a pill that cured something, you would market it worldwide because of economies of scale.
Yeah, but it's if you're a United States company, it's protected by the FDA. Your data is protected by the FDA.
Even though you have to go get it approved in France?
Yes.
France doesn't require it. So those 22 are different ones.
Mm-hmm.
So in some sense, comparing 22 to 1 is apples to oranges then.
I mean, they're both still life-saving. I mean, they're both still biosimilars. I don't think they're apples to oranges. I just think that
Then maybe, I don't know.
the structure of pharmaceutical production is just much different in the United States and Europe.
Are the antitrust provisions within the EU one of the reasons why the power of the pharmaceutical companies is somewhat diffused, in the sense that, you know, you found, for example, GE and Honeywell couldn't merge in Europe.
Yeah, I mean that's definitely possible. Europe has like a very strange approval process. You can either be approved centrally or you can be decentrally approved. They have a huge problem with what's known as linkage, which means that two drugs that both have the right to be exclusive in the market can be in the same market, and that's makes a lot of living for damages lawyers. But as far as I know, I think it's due to the fact that Europe just tends to want a liberalization of the pharmaceuticals market, and so they mandate that all biologics be approved centrally and all biologics release their data.
Socialized medicine, they want cost control.
Yeah.
Thank you, Caitlin.
Thanks.